Mabel, Jong. Welcome back. This is the HCEG Summit coverage from Boston. And I'm so pleased to have Megan Callahan here. She is VP of Healthcare at Lyft. Welcome, Megan.
Thank you for having me. And thank you to HCEG for having me.
Yes, I understand this is your first visit to the summit.
It is. It is. It's been great so far.
And what sort of information have you been sharing with members here today?
Yeah, I was on a panel leading a conversation around health equity and social determinants of health in conjunction with Dr. Erica Pabo from Humana and Rob Garnett from Amerigroup in Tennessee, which is an Anthem company.
Okay.
And we are working with both of them. So we were talking about their experiences working with Lyft, both within a Medicaid population and in a Medicare Advantage population.
So since 2016, I understand that Lyft has been partnering with different health plans to provide transportation services to members. Can you give me some details on how the program works?
Sure. So Lyft has been in healthcare since 2016. We work with transportation brokers who then partner with the health plans. So those are, I won't name the companies specifically, but there's very large scaled players that manage the transportation benefit on behalf of health plans. And we have relationships with those organizations and then in turn work with the payers. Medicaid is a very big focus for us. Transportation benefits have been a part of the Medicaid program since the program's inception. And for Medicare Advantage, they also do support transportation to medical care, but very interestingly, over the course of the last year or two, they've created some flexibility in the MA program to allow plans to also provide things like transportation to support an overall health and well-being of their members. So really interesting conversations with Medicare Advantage plans around how they would think about including additional transportation options outside of medical care. So things like going to the pharmacy or going to the gym or going to community events to reduce social isolation, which is often correlated with chronic disease and decline, particularly in elderly populations.
Okay, so right now the program is mostly focused on getting people to doctor appointments?
Correct, to doctor's appointments or to things that support their health. We actually just released a study that we did with United and USC and AARP, which gave unlimited Lyft rides for 3 months to a senior population. And we had amazing outcomes from that study that showed that those seniors reported a 90% increase in quality of life. And interestingly, only about 15% of those Lyft rides were used to go to medical care. The other 85% were used to go to see family or go to social events or go to fitness. And we really see that as a really important shift that we're making as a country to engage people in overall health and not just medical care. And I think for Lyft, what I'm really passionate about is making sure that we are the way that America can access health.
Yeah. And what happened in 2016 to start this program? Any sort of event that got people talking at that time that this was something that needed to be done?
What we saw, like many things, that the consumer leads you to the opportunity. Lyft and rideshare was obviously becoming more at the forefront, and we saw healthcare organizations actually calling rides for patients from their cell phone. Lyft Healthcare does not use the consumer app, so it's not how you or I would use Lyft to go to the restaurant. It's a business-to-business platform. So the sponsoring organization, whether that's an insurance company or the health system, calls the ride on behalf of the patient or the member. And then the member, like my 83-year-old mother, doesn't need to figure out how to download the app and call the ride for herself if she doesn't want to. And then we text the member if they do have a smartphone and say this is where you should be to meet your ride, or if they have a landline, we can create automated calls to that landline to remind them of when their pickup will be or when their drop-off would be.
Okay. Megan, how big is the program? You mentioned that it's a national program. Approximately how many people use this?
It's a national program. I'm not allowed to discuss specific numbers, but it's a large part of Lyft Business, which is our business-to-business group, and certainly a very vibrant and growing part of the business.
Where to from here? Are any plans to expand it to other types of services, or can you share any details?
There's two things that I'm really focused on, one, we recently announced that we're an enrolled provider in the Arizona Medicaid program. So continuing that work, I was here today talking with Rob Garnett. We're doing work in the state of Tennessee in Medicaid. So when Medicaid was created, around the benefits around transportation, the regulations were written in a way that did not contemplate rideshare, did not contemplate, a car that was not owned by a company or a driver who was not an employee of the company. So working to modernize the approach to Medicaid and incorporate rideshare is really a big focus of ours. If you took and incorporated rideshare into Medicaid nationally, we would save over $500 million a year, because Lyft is on order about 30% cheaper than traditional transportation options. So that's a very big focus for us. And then of course, Medicare Advantage and working with Medicare plans, as seniors are obviously becoming a larger and larger part of our population, how to really not only get them to medical care, but how to get them to engage in life and other things that support their health is a very big focus for us.
What was the alternative? What were people, it's hard for people to remember life before Lyft.
Right? It is.
So
it is.
What were people doing then?
Well, I would say, I'll tell a tale of two cities. For Medicaid, obviously it's a cost-sensitive program. It's not uncommon for patients to be put into a van or a shuttle with 6 other members and maybe be 2 to 3 hours in the car to go a distance that should probably take you 20 minutes. So obviously on-demand transportation is a much preferred substitute for that. And I think allows people to engage in their healthcare life as they do in their normal life, which really increases customer satisfaction of those beneficiaries. And then on the Medicare Advantage side, and for seniors, often there were other transportation options, or they were just relying on a family. And I think there's a high degree of guilt that's associated with that. And obviously, a challenge as children or people in their community have busy lives. So I think it has really the opportunity to increase independence and self-reliance in the senior community, which would be hugely beneficial.
How do seniors or any patients find out about your services?
So they do that through either their health plan, and their health plan generally has them engage with their transportation broker. So often it's a 1-800 number that you would call, and you book it in advance, and they assess if that member or patient is appropriate for a Lyft. Not everybody's appropriate for a Lyft. You have to be able to walk to the car and get in the vehicle and exit the vehicle. And the value the broker provides is they can do that assessment and that triage, allow them to get into a Lyft, or if not appropriate, get them into another type of transportation mode that is more appropriate for that member.
And what about the drivers? Are these different kinds of drivers, or your Lyft community drivers?
There are Lyft community drivers. So we're bringing the power of the entire Lyft driver community and network. We reach 96% of the United States, and I think one of the values that we offer is a consistent experience, whether you're in Tennessee or Boston or San Francisco, you know what you're going to get with Lyft.
Excellent. This is your first time at the meeting you mentioned.
It is,
How
yes.
are you finding the community here, your experience, the sessions that maybe you're attending?
Community's great. Very varied content, intimate and really learned group with a lot of experience. So it's been great to talk to people and understand their experiences and obviously share the Lyft story.
Well, it certainly is exciting to have you here on site, and I'm sure members are getting a lot from what you're saying. Are you also bringing something back with you to Lyft?
To Lyft, certainly. There's a couple sessions this afternoon. If I looked at the HCEG top 10, anything that's focused on social determinants of health is a dialogue that I'm really interested in. I view transportation as the cornerstone of social determinants of health. Not only is it SDOH unto itself, but it's a conduit to others. So we talk about food insecurity a lot. If you can't get to the food, or the food can't get to you, it's hard to solve that problem for patients. So having some good dialogues here with others about those types of things.
All right, Megan Callahan, thank you so much for your time.
Thank you for having me. Thank you very much.